No, I don't have the flu, and neither do these three medical professionals to my left, but too many Americans and too many Wisconsin residents do. So I've asked a panel of medical professionals to come to talk about Wisconsin's flu season. To my left is Tom Haupt. He's the state influenza surveillance coordinator for the Wisconsin Department of Health Services. Dr. Janina Smith is an infectious disease physician with UW Health, and Dr. Bill Kinsey is Director of Health Services for UW-Madison. Thank you very much. Glad you're all well. I think we should start out with perspective. We've seen the national news. We've seen people being treated in tents. Could you put Wisconsin's flu season, could each of you put it in perspective, please? Tom, you want to go first?
Yeah, I think this flu season obviously is one of the most severe that we've had in recent decades. We had a severe influenza season in 2014-15, which we thought was going to be the highest for a long period of time, but this year is actually being worse. We haven't seen the numbers that they've had in California and some of those places, but we've already surpassed our total number of hospitalizations for a year. We're up to close to 4,900 so far since September 1st. We've never got as many as 4,700 in any severe year. Our ICU admissions are higher than they've ever been. The people on ventilators is as high as it's ever been. It's really a very, very severe year. The media has really pushed the issue out there. It's drawing a lot of media attention, both nationally, internationally, and in Wisconsin. So this is something which I would consider to be worse than the pandemic in 2009 and worse than the 2014-15 season.
Thank you. Doctors?
Yeah. As a clinician, I've seen terrible results of the flu this year, both in my patients, but also I'm a mom. And just as an example, one day when I got called to pick up my kindergartner with fever, he was the one of 6 classmates left in his classroom. So it's had a broad impact. My specialty is transplant infectious disease, and it's had a really profound and horrible impact on my transplant patients.
Doctor?
The demographic I work with is on the college campus, and so we're seeing the impact there as well. So more students who are ill this year, in spite of our efforts to limit that. That impacts their academic achievement during this semester, and is something that we work really hard to try and limit. But it has been impressive to see the national data. I believe this is the first time in over a decade where every single state in the country was registering high activity at the exact same time. So both Wisconsin and the rest of the country has really seen these effects.
I'm sorry if this is a simplistic question, but is Wisconsin getting hit harder than other states? Maybe that's meaningless, but just by comparison, your thoughts?
My thoughts are we're pretty much the same as the rest of the states. There have been a couple of states like California, Arizona that were hit harder earlier. They actually did start using tents and then ran out of antivirals. But as Dr. Kinsey said, the most part, all of the states are in the same boat. We're all in very high, widespread activity. All of our indicators are much higher than they have been in previous years. So I wouldn't put Wisconsin above any other state. I'd say we're all pretty much in the same boat.
You know, one stat that you just brought in, Tom, and it's very interesting. The positive influenza results from September last year to now, 13,037.
Yes.
Hospitalizations, as you just alluded to, 4,873, which is 37% of those positive in Wisconsin end up in the hospital. How does that compare to the national average?
I think that's pretty close. We also have to add that these are the numbers that I gave you are PCR tests, where we also have rapid tests too. So it may be a little bit lower, but nonetheless, these numbers I think are very applicable to what's happening throughout the United States. We've had many influenza 50-state call and a Midwest coordinator call, where all seem to be very much at the same boat, much higher incidence of hospitalizations, much higher numbers of actual cases.
And who does it strike, doctors? Does it most strike the young and the old over 60? You mentioned, did your 6-year-old have it?
I didn't have him tested. He was vaccinated. You might expect an infectious disease doctor's children got the vaccine on the very first day it was available. But children are, of course, most at risk for, small children, most at risk for the dreaded complications of flu. That's along with the elderly or patients who have chronic diseases. My organ transplant patients who have suppressed immune systems are more at risk for complications. But really, anyone can get the flu. Anyone can and do.
Do your college students tend to recover more quickly because they're younger and think they live forever or things like that? Overstatement, Dr.
If I
Bill.
can speak for them, maybe not. So, no, the symptoms with this flu season have been quite intense, and I think what we're seeing a lot of is this H3N2 version of the flu this year. And it certainly affects all age groups. Children under age of 2 are always a concern, but in particular, I think hospitalizations, we've really seen this in the elderly, or at least those over the age of 65.
Yeah, about 65% have been over 65 years old, and if you go to the 50 to 64-year-olds, we're up to 85%. But nursing homes have also been hit hard, the whole continuum of long-term care. We've had close to 400 outbreaks, and some that had fatalities as well. It's been a very tough year for long-term care facilities. That's why we continue to preach, vaccinate not only for yourself, but for those people who are around you.
You mentioned, Dr. Bill, the specific type of flu. Now, I understand that there's always this great guessing game in terms of what type of vaccine to mass produce, and you never really know with true accuracy whether that's going to treat the type of flu that's more. Can you explain that guessing game is inappropriate, but that, let me use another term, can you explain that inexact science?
There's a process that happens on the international scene where there are monitoring systems both in the south and northern hemispheres, and approximately 9 months before the season comes to us, those decisions have to be made. And one of the difficult things with influenza is that it changes frequently. So even in those number of months or in the way that the vaccine is produced, it can encourage changes that allow for inefficiencies in the outcome of the vaccine.
And did it line up generally this year? Did the type of vaccine that was mass produced and that I assume the shot we all got, did it match up, or was this not the best year for accuracy?
This year was a pretty good match. 2 years ago, the 2014-15 season, it was a total what they call drift. It did not match at all. The numbers, the vaccine efficacies were in the single digits. But this year, at least on paper, it looks good. But the influenza H3N2 that Dr. Kinsey was mentioning, it just doesn't have the vaccine efficacy as the other vaccines. It does not grow well in eggs, which is an archaic method of actually making vaccine. But on paper, it looked pretty good this year. It wasn't as good as what we would normally have seen. I don't know if you have any thoughts on that, Dr. Smith? Any additional thoughts?
Well, I think one thing that I'd really like to get out there is people focus on these numbers that are put out in terms of vaccine efficacy. Yes. But something that I think that they don't understand, I don't think it's general knowledge, that when we talk about vaccine efficacy, the way those trials are done are sometimes to check and see if someone has breakthrough flu. But it's very hard to judge whether the flu that they had is milder than the flu they would have had they not been vaccinated. And that, as a mother of small children or as a doctor who cares for immune-compromised patients, yes, is really, really important, because I certainly don't want my kids to get the flu, but when they're out of school for 2 or 3 days and they survive, that's obviously my goal. And what we know from, sadly, the pediatric deaths is around 80, sometimes more, % of the deaths have occurred in unvaccinated children. So while there still may be some breakthrough in my patients who don't respond as well to the vaccine because of their weakened immune systems, or in young children, if we prevent them from dying or having complications of the flu, that's a very significant advantage, and I think that's what we all care about. So I want to use some caution in looking at these numbers of how potent the vaccines are, because the way that we're judging potency might be you feel a little achy that day, you swab positive for the flu, so you're a vaccine failure, but you might have been so sick you were one of these hospitalizations had you not taken the vaccine, or God forbid as a child, been a fatality. So I think as a parent and as a doctor who cares for patients whose immune systems are weakened, I really want to advocate everyone to still get the vaccine, because it may be that though you got the flu, your flu was much milder.
Now, you had mentioned earlier that when you treat someone with the flu, you're very worried about complications.
That's
what
right.
Complications?
So when someone gets the flu, it inflames their lungs and puts them at great risk of getting other infections like pneumonia. And so bacterial pneumonia is a common cause of complication or hospitalization after the flu. And associated with that also can be this syndrome called sepsis, which is where the whole body's organs stop functioning well. The blood vessels leak, they have kidney failure, liver failure, and that's what we're seeing. And so patients, it's not always just the virus itself, it's that the virus comes in and it beats up the body and puts it at risk for other infections. And so that's something we see in the mortality data also. Sometimes there's associated mortality, so someone had the flu and then later they had bacterial pneumonia and that was the cause of their hospitalization or death. Additionally, we've seen a very strong association with people who get the flu and later have heart attacks. And this probably relates, again, to inflammation in the body. Anything that creates inflammation can put those plaques in our arteries at risk for rupture and for myocardial infarction, heart attack, or arrhythmia.
Is there any age tie-in to that, Doctor?
Certainly. Patients who are more at risk for heart disease in general are much greater risk of getting that complication of the flu.
Can we talk about vaccination rates? Overall, do Wisconsin residents vaccinate at a higher or lower rate than the national average?
My understanding is, talking to our Wisconsin Immunization Registry people, is that we're lower than the national averages.
Significantly, sir?
I would say that's in perspective, but it is definitely worrisome. You know, we're right now about 32 to 33% of our people have been vaccinated. Our ultimate goal for the 2020 Healthcare Association was to have over 70%. We're obviously not going to have that, but we are really struggling to get the vaccination rates up. And it's been very difficult. We're known to have lower than average numbers than compared to the other states.
Why?
I wish I could give you an answer on that, Steve. I really don't know. We've tried so many different things, so many different PSAs, public service announcements. We've tried Facebooks, social medias. We're going to continue to try until we get this thing right, but we really need to get that word out that, again, the purpose of the vaccinations, yes, it will help prevent flu, but mainly to help prevent the complications and to protect those people who are
What about your
around you.
college students, Doctor?
That's a great question, because that age group is the exact age group that has the lowest uptake of influenza vaccine. So, right, we're shooting for 70%, and typically nationwide we're close to about 40%. So Wisconsin is lower, but the whole nation needs to do better, quite honestly. We've tried to be innovative on campus around how we bring flu vaccine out to the students, and we actually have vaccinated over a third of the students. So we're probably beating the overall state numbers right now, and that's in the least likely to be vaccinated group. So maybe we've got some ideas for the rest of the country.
This really fascinates me. Our overall state average, 32 to 33%, excuse me. Mm-hmm. What about children? Do you think it's, I would hope that it's higher. Is it, do you think?
The statistics show that it is slightly higher in children, but it's still far below the benchmark.
What about those in their 60s, do you think?
That's, but again, it's a higher percentage of when you get over 60. But as Dr. Kinsey said, as you get into the teenage years, early adult, that's where we have the big drop off as far as immunizations. But there's really been a big push over the past few years to get the elderly population, especially those who are in nursing homes, to get vaccinated as quickly as possible.
Well, I recently saw a national story which was tragic. A young mother with 2 young children died after getting the flu, and the reason she didn't get the flu shot was the cost, $160. Is cost a factor in some of the reason why the overall Wisconsin average is 32 or 33%? Do you think?
I just want to clarify, in that particular case, it was the flu antiviral, also Tamivir, the copay. And I think that is a real tragedy, because we know that that particular antiviral medication is far more effective if you take it early in the course. The earlier, the better. Yes. And so the delay in her receiving that medication could have been significant, certainly in severe flu. That being said, I think that access to health care is a concern in terms of the availability of flu shots, flu shot clinics. I'm not aware of the specific copay for the flu shot for different plans, but access is always an issue.
For college students, is there any copay or out of pocket if they want to get a flu shot, Doctor?
You know, we have allowed them to get the flu shot at no cost, although it's ultimately paid out of their tuition. So that is, I think, a model when you take away the cost from the process of getting the vaccine. where it's much easier to bring people in and receive it. So I think you're on to something really important with that concept that if cost is a barrier, it's a high barrier.
Why do college students say they don't get flu shots, sir?
It's a while since I've been there, but I think you feel invincible at that stage. So, you know, when we typically want to vaccinate people, and we started a little slow this season. I don't know if you remember, October was a gorgeous month here in Wisconsin.
Yes.
And it was really hard for college students to be thinking about taking care of themselves for the winter and for the typical flu season. So there is a need for people to understand the benefit of getting it early and the coverage for the whole flu season.
Just to quote a headline today from Bloomberg News, we could be turning the corner on the flu season, the flu epidemic. It seems to have passed, and it's begun a slow retreat. Is that true, both nationally and in Wisconsin, do you believe?
I think in Wisconsin we are right at peak season or just past. But as I was mentioning to you earlier, the message I need to get across now is peak activity does not mean you go from peak activity directly to nothing in a matter of weeks. We are still going to be at very high activity for at least another month, but I think right now, based on the statistics I've seen and our markers, we are at or at least 1 week past our peak in Wisconsin.
Okay, now somebody's watching this may come away, well, I don't need to take a flu shot. It's February 16th. Wrong message?
Wrong message.
Wrong message.
Why?
Yes. I think a couple of reasons, and I'm sure you would contribute additionally to this, but my understanding is the typical H3N2 variety we were seeing early in the season does often present early in a flu season. And so we're starting to see the peak activity probably cresting there. But what we are seeing is that a secondary type B flu now is becoming more prevalent. And so, unfortunately, we're going to have a long flu season, I think, this year because of this dual strains that are out there.
And I have seen patients who've had both. So they were tested positive, they knew they had influenza A, they come in, they have classic influenza-like symptoms, we retest them and they have influenza B. There's actually two-way strains that are circulating. So for a given individual, there's many reasons to be vaccinated, including now. There's multiple strains, so even if you already had the flu, you can get another version of the flu. Your immune system will be weakened just from having been sick, and you'll be more at risk for complications if you get serial viruses. You miss work, there's these other risks. But also, I think my belief in patients that I meet with is that most humans are altruistic and they care about others. And what we do know is that this younger group of patients, so children and young adults, when they get the flu, they bring it home. They bring it home to their parents, to their grandparents, to other people whose immune systems are not strong enough to have as good of an immune response. And so when I remind people, how would you feel if you knew that you brought the flu that made grandma go to the hospital to her when you were having a nice Sunday dinner? And they don't want to do that. Of course they don't want to do that. So there's a lot of reasons. I also like to address with patients some of their concerns. I think some of the barriers to vaccination at any point in the season are things like they believe that they're going to get the flu from the flu shot. And you can't. There isn't currently a live virus vaccine, so there's no virus in the flu vaccine. They can't get the flu from the flu shot. And so when I ask them what their specific concerns are about the flu shot, we often can have a very productive discussion. And I think February 16th is no time like the present. It's the time to get the vaccination.
Is there a average time from average time from onset to recovery from the flu? Another national news story said you are most infectious when you're just coming down with it. Is that true?
Probably yes.
Is there an average period from onset to recovery?
So when patients acquire influenza virus, they may not have any symptoms within the first couple days, and they can certainly be infectious before they have symptoms. Again, that's another reason for vaccination, to help reduce the amount of virus that they're shedding. And then typically, several days later, 2 to 3 days, they start to have the onset of clinical symptoms, fevers, terrible aches. I saw a really funny algorithm, not really funny, but that said, do you feel like you've been hit by a train? And then it said, have you been hit by an actual train? If the answer is no, you probably have the flu. So we sometimes use the term prostrate, meaning laid out. So people have these terrible muscle aches, terrible symptoms, and flu is respiratory and have a respiratory infection. And then typically patients will start to improve over the course of several days to about 2 weeks is the limit of what we expect flu symptoms to last. During that time frame, they can be contagious to others. And most people don't have 2 weeks off of work to not go back to work and spread it around to other people. So there is a typical expected course, and if someone gets ill again, then we start to wonder, did they get a different flu? Or did they get one of these feared bacterial infections that can make people sick so rapidly?
We have had no deaths in Wisconsin. Have we just been lucky?
No pediatric deaths in Wisconsin.
Thank you for clarifying.
There have been fatalities in Wisconsin. We know that. Most of them have been the elderly. As far as pediatrics, yes, we've been lucky so far, and I continue to knock on wood, and I'm hoping this is wood, and I'm not jinxing myself. But we have never had a season where we haven't had at least one pediatric death. Nothing so far this year. I really hope that would be the silver lining of an otherwise very severe year.
Okay, let's turn to precautions. Get a flu shot, even though it's February 16th, and what else? You're the professionals. Precautions.
I think, things that we've all heard about other contagious diseases hold true with influenza as well. So frequent hand washing would be at the top of my list.
Mine too. I sometimes joke that I don't have stock, but maybe I should in the alcohol hand sanitizers because carrying them as a lanyard around your neck or a clip on your backpack and using them as frequently as you can think of, I think is something I recommend.
Well, I use this to draw attention, but what value are they? Who should wear them?
I think in general, I think about sort of distance first. So we know that if you're more than 3 feet away from someone, your chance of having them during the course of coughing, sneezing, or even speaking is unlikely for you to pick up the flu from them. I have not really recommended to my patients to be wearing those in public, but you could imagine if you were going to be for a long period of time at a sporting event next to someone who was coughing, you could get the flu.
Is another,
yes.
That's very much, I've seen that quite often too. So,
now, Wisconsin is considered to have such a strong work ethic. Does that mean even though we feel bad, we still go to work?
Unfortunately, that does happen a lot, and one of the other preventions
That's a very
that we look
inexact
at.
line.
Yes, yes.
Yes, I have a slight cough, but I have this project due, so.
Yes, I'm not contagious. It's only allergies. I don't know how many times I've seen that and heard that. Where people are coming in, but in fact, maybe you've got the flu shot and they have a mild case of flu, but they still spread it to the people around them. You really have to give yourself some time to heal when you have influenza or any kind of respiratory illness. Stay home, drink some fluids, get plenty of rest. And if you have to go out, and you have to make sure that you have the proper cough etiquette. Coughing into your sleeve, throwing away the tissues if you do sneeze, putting them away, using the gel as Dr. Smith says. Those are some other things that you can do to protect yourself. But yes, it happens way too often where people really don't believe that they're contagious, but yes, they are.
Are you three medical professionals concerned that the influenza strains are getting more serious and that every year there seems to be a trend that it's a very growing critical health crisis? Just thoughts? I realize you're not with the CDC, but just your impressions?
I'm not certain that the viruses are getting more aggressive, if that's your question, but the change in our patterns of travel, congregates of people are probably what I would guess is more associated with the bad flu seasons that we're having. And there's some things about the virus, and there's some things about certainly the both the effectiveness and the coverage of the vaccine. But I think even more is that you can go, and people can and do for work, go from state to state, from country to country every day. And when you have this Wisconsin work ethic, you're not feeling so good, you hop on a plane, it's a nice enclosed area, then you can spread illnesses very quickly. So we saw a countrywide epidemic this time that we haven't seen before, and I suspect it more relates to those factors.
Is there hope in some of the research that's being done, number one? And number two, is there strong research with going on this campus on the flu?
Yes. Yes, Dr. Karoko is a nationally owned influenza researcher. He's got a big lab on the west side of town. He's doing a lot of research on a lot of the bird flus. Even he's starting to work on some of the domestic and seasonal flus as well. I had a chance to meet him and see his lab not too long ago. It's really amazing what he's done. To be honest with you, I don't totally understand it. It is way above my head. But he has done some really excellent work. So there is a lot of research going on at the UW.
And the CDC doesn't have a director right now. Are you concerned about the national research? A pause in the national research as we deal with the funding of the CDC and finding a new director? Thoughts?
Well, I have all the confidence in the world in Dr. Ann Schuckett. I've known her for several years.
She's the acting director.
She's the acting director right
Yes.
now. She's incredibly smart. You know, and she's been involved with many different projects in addition to flu. So I don't have some concerns technically. Funding is always an issue, and we just don't know what to think about that. I mean, we have a new president come in. We just don't know how it's going to affect the CDC and the National Institutes of Health. We're all just kind of waiting on pins and needles to see what the final outcome is.
Okay. We're almost out of time, but I'm curious, Mr. Haupt, you brought us numbers by region. The southern region, 42% of those tested positive for the flu, yet only 25% in the northwest region. Is there a regional disparity in the incident of flu in Wisconsin?
I think there's a regional disparity in the number of tests that are done. There's certainly, in the southern region, a lot more tests are done than are in the northern portion because of the populations. I think that's more or less what you're seeing here. But I don't see that the significance in the positivity rates is much anything that would shake a stick to me to be a problem. Again, some doctors will test everybody. Some doctors will just think, hey, it's the flu. Either way is fine, but what we do is we try to follow our protocol, you know, with our laboratory surveillance, and unfortunately it's just different in different regions.
Okay, let's end it this way. Each of you, a short statement putting the flu situation in Wisconsin, the flu season in Wisconsin in perspective. Dr. Kinsey?
We still have a significant portion of the season ahead of us. Get immunized.
Thank you. Dr. Smith?
Protect yourself and others. Get immunized.
And Tom Haupt?
Absolutely, and I'll just piggyback on what Dr. Kinsey said. We are at peak activity, probably a little bit beyond, but we are going to have high levels of influenza probably for the next month or so. So don't let your guard down. As long as there's vaccine available and you haven't had it, get it to protect yourself and to protect others.
Maybe I do have a follow-up question. Are we seeing the shortage of saline bags given the harm and the destruction of the factories in Puerto Rico and fluid problems show up? So I apologize for one more question, but it's what I do.
I have heard that I don't know for sure. I don't know, maybe one of the doctors would have more resources, but I have heard that there is saline shortages throughout.
Mm-hmm.
So
any personal knowledge of them?
I think there has been shortages, but our pharmacy department at University of Wisconsin has done an excellent job securing resources for patients. And thus far, we haven't had a shortage of vaccine, antiviral drug, or ability to give fluids to patients who need them.
Okay. Takeaway, not too late to get a flu shot. And if you feel sick, don't go to work.
Stay home.
Stay home. Okay. I want to thank Tom Haupt, Dr. Janina Smith, and Dr. Bill Kinsey for talking about Wisconsin's flu season. And we don't need this. Thank you.
Thank you.